Hey, this is Different Careers with Kate Nudd, and today we're going to continue to go over massage therapy principles and practice, but we're going to go over the first 5 chapters, and it's case studies only. So, we've already done videos on this, but that's how I'm going to go over the case studies because they could bring up stuff. So, again, chapter 1 was over the history of massage and, different people helped, create massage. So, this is not a case study. So, it says professionalism. While not exactly a case study, this activity will help to familiarize yourself with the organizations that inform the service of our profession. Use the internet to look at the following organizations: American Massage Therapy Association, Associated Bodywork and Massage Professionals, Federal of State Massage Therapy Boards, National Certification Board of Therapeutic Massage and Bodywork, Massage Therapy Foundation, Massage Therapy Body of Knowledge. Locate information regarding their history and current events. Write a brief paragraph about each organization and share it with your class. Instructors feel free to create an online discussion and ask students to post their findings. So when I was in massage school, I don't remember doing all of this, but they did briefly mention before I graduated, oh yeah, you need liability insurance. So initially I did this one first, AMTA, and I did not like the service in full that they provided, but it was cheaper in the beginning for students starting out, so I forked it over. What they did is, with this service, you got a free online website and you could do your business, but you were limited to 5 pages only for your website. That's it. So then when I switched over to Associated Bodywork and Massage Professionals as my liability insurance, they provided unlimited pages that it seemed to your website for your massage therapy business, because that's what I tried to do, was open my business right off the bat. And then the website I have gone to is New York State license. It's like you type in New York State government massage therapy license. It's like it actually gives you the website, I think, on your registration for your massage therapy license. I forget, but it's like those are the websites I've gone to the most. I think I might have looked at that, but it didn't. See, the nice thing about the Associated Bodywork and Massage Professionals is when you pay for the liability insurance, like they covered your continuing education credits, so you could do them all online. You didn't have to pay money to go to school or learn a different technique or whatever. So it was like, boom, they were included. So one of the things I did do is I really got into the Rosen method of body work. So I went to one introductory intensive. I went to 2 bigger intensives. Like one was like probably 5 days. The other one was like almost 5 days. You arrived and then they cut like 5 credits off the time. But I was really excited about the Rosen method of bodywork because I was like, I'm going to do this. It's a different bodywork modality. It combines a touch and the emotional component of touch, where it's like basically the principles are for the Rosenbody, a body work method is you touch somebody, you're providing a safe place for them to be touched, to sense what's going on with their emotions, to express them, and then whatever comes to mind, they tell you how they truly feel, and then that is released and accepted. And because you could have gone through trauma or different negative experiences and emotions got trapped inside your body somehow, or the muscles, and so by receiving that touch and allowing that safe place, it allows those emotions of what you're truly feeling to come up, and then you're able to express it, and it allows for more healing and like getting rid of negativity, because you're getting it out. You're not keeping it bottled up inside yourself. So I really enjoyed it. It was very therapeutic. So for the majority of the years, like I had this, I wasn't even using the continuing education stuff. So it's like the first 3 years, it's like, oh, you school counted as your continuing education. So I was like, I'm not going to do anything. So that's why for the first year I went with AMTA for the liability insurance. But I didn't like the feature that it only had like the 5 pages. It was very limited, and like starting off it was like okay, but it was like you're stuck for a year, and I quickly found out I need more pages than 3. So then I switched to this, was much happier with that. And then there was Massage Book, and Massage Book was a great tool for, it's like, here, keep your soap notes online, and that's like all your client information. And so in the beginning, I was really doing like my own paperwork and everything. And it's like, I quickly realized, yeah, I like the paperwork technically better, but I don't have the room to see like a new client all the time and be like, oh, here's this paperwork and this paperwork and this paperwork and this paperwork and this paperwork. And then you had to keep it and everything. So it was just like, you had all this, because it's like, it was hard maintaining returning clients. So so you had Massage Book. So it's like www.massagebook.com. And then in the beginning, I got the free option, and then I upgraded and paid, and then you could send legitimate emails. So if you're a new massage therapist starting off, I would highly recommend just buy for the full service of Massage Book, get all the features, so then you can send out email reminders on a massive level, like once a month, to encourage your clients to come back. So there was a whole bunch of business things that I was doing wrong because I was scared of spending money. But again, it's like there was no true effective way to bring in the clients, and then you want to post something somewhere, it brought in a client, but is like, was it really worth $70 to get that one client? Like, for a advertisement. And so I tried different advertising things and nothing really worked, and I didn't know what to do. And it was like, there was this one website that I forget, I think it was called Yelp, where it's like, you can advertise your massage therapy business here. Okay, they wanted to pay like $300 a month for we're going to allow you to put a video up on our website. And it's like, well, why can't you just, somehow put a video up on your own website? And it's like the whole point is like to attract people to your website so that they understand all like the services that you offer, so because you're trying to establish clients and you want people to thoroughly read what services you offer. Sorry, I am getting over being sick, so I'm trying to multitask. Okay, so you have this one I use the most. Then I did a bunch of continuing education class videos on through this one where you saw like, oh my gosh, I'm not sure that people know what they're talking about when it comes to health, because it seemed like some people were making up stuff that didn't make any logical sense to me. And then there was another website called Groupon, where it's like people were buying like the cheap massages, and basically their whole attitude every time they came in to get a massage was, I want the cheap massage. I don't really value that you're doing a legitimate job and that you need enough money to pay all the expenses of life. So even though your Swedish massage is $80, I'm only going to give you $40. That's all that's all you're going to get paid for, or whatever. And it was like ridiculous. Or technically Groupon was like, we're gonna sell it for $65 or whatever, and you're only gonna get 40% of it. And it was like, or like $40 of it for income. So what does that mean? You're literally getting paid for some of the time in the hour if you do Groupon. However, Groupon technically, if you look at it, in a spa setting, if I had stuck with Groupon, I would have gotten paid more in the long run. But then you would have to put in the clause, you're required to show up to your appointment. You are not allowed to cancel your appointment. But like, because technically I put in there's like a 24-hour cancellation policy. Well, what people did, some of them was like they decided not to show up, and then they put themselves on the calendar, decided not to show up, and then they got a refund for their Groupon. So they were literally wasting your time and everything. So it wasn't a legitimate service for massage therapists. So that's what these websites are bringing up. So in the end, it's like, well, how do you start off your business? They said it was word of mouth. Well, then how come I didn't get tons of referrals, even though like the majority of clients were like, you do an excellent job. Even the Groupon clients were like, you do an excellent job. How come they didn't ever want to come back? So it's like, they obviously went and saw other massage therapists. It's like, okay. So, well, if everyone was going to be a massage therapist and there wasn't enough clients for everyone to receive a massage, for every massage therapist, if there was like not enough clients for every massage therapist to get and receive clients, then it's like I probably would have picked another profession. But no one had that courtesy or that like common courtesy to me. Like, I don't think you should be a massage therapist because if you go into it, these are the types of problems you're going to have. It's very hard to run your own business off the bat. You really need to work for somebody else. That's what I wanted to do. However, when I decided to go to school, it was like the whole classroom was full, and all of a sudden everyone wanted to be a massage therapist. And it was like, I thought it was going to be like a smaller school setting, a decent amount of students, that the teachers would have time to like thoroughly work with each student. And it's like, why do we have like 60 people in the class? And it was just like, so the year I decide to go, it booms. Then after I leave, then the massage therapy school students shrink. Where, I'm sorry, there isn't enough students this year. So there's a limited amount of massages because, like, the school I went to, In New York, massage therapy school, they had like this thing in the beginning where it's like, well, okay, you can come in after you graduate once a month and you can receive while they're doing their massage clinicals, was the stipulation. You can receive a massage once a month for free. As soon as I graduate or in the process of graduating, new owners come in, take over the school, and they're like, we want to make money off of this school. So I'm sorry, but alumni aren't allowed to have a massage for free anymore. You have to pay out of pocket for it. And it's like, hello, these students are learning. They're not good yet. Alumni have the ability, especially to critique the students and help them improve their massage skills and be like, this is what you could do better, because they could have that conversation with them, you know? And like, are you getting the pressure right? And basically they're like, nope, we don't value the alumni for this school to help the students improve their massage skills anymore, is basically what happened. So it's like, do you really care about teaching your students to be effective licensed massage therapists after they graduate? I don't think so. So it seemed like the owners who took over, it's like they knew nothing about massages and they were like oblivious to like what students actually need to learn. Anyways, that's my point for, I guess, this case study. So why might it be important for a massage therapist to understand the history of the profession? Like, that's a tough. So I guess we're doing case studies and critical thinking. Okay, why might it be important for a massage therapist to understand the history of the profession? Well, if you understand history, where there's this idea that maybe initially it was like massage was about touching somebody else. You did maybe one location, and then as people discovered more and more about health and it's in the history, then you're like then people went through and understanding the muscles. It's like, it's, I think for me, to be honest, to make it more simple, is there's different types of massage techniques. There's different types of massage. It's easier to understand the history of your specific massage technique that you are learning. So for instance, the Rosen method of body work, it's combining in basic terminology a little bit of psychology with touch, and it's basically providing that safe place for you to express your emotions. Well, the person that really fully developed the Rosen method, the last name of that individual, they were a girl and their last name was Rosen. So it stuck, and that became the name of the profession. But this individual, this girl, she learned and got trained from other people, and it was like the experiences that she gave was like, because you learned how to do the hands-on stuff of provide that safe place for someone to express any emotion that they have. When people came to them and they had health problems, like the way it was described in the books and the teachers that I saw, was that she was able to provide such a safe place that when those emotions got fully released, that people were healed. People are able to become healed in certain areas of their body. So And like this, what I was reading, it was claimed that she could do it in 3 sessions. That's how good she was, this individual, Mrs. Rosen. So it's like the history can also help describe what's going on, but it also tells the journey of that individual and how they went to school, learned from others, and they might have like, okay, like some of your technique, I like some of your technique, here's my full technique, and this is how I made it work 100% effectively and was 100% useful for my clients. And so also the other thing is, initially she was just doing this as a profession, but because she helped so many people, then what happened is other people wanted to learn. So then she had to do a school. And so she taught a whole bunch of students. And then they created the Rosen method of bodywork. So initially it was just her last name. And she became so successful and effective that other people wanted to learn it too. So I wanted to do that too, but because of the COVID-19 epidemic that happened, that was cut, dropped, and it's gone. Like, can't do it anymore because everyone's so scared of becoming dead from the COVID-19 virus. Some people are scared of dying from the vaccination. So it's like, I'm not scared of any of it anymore. But it's just like, that was my plan. And because of this epidemic, it completely wrecked that plan. But it was like, I really truly believed in, expressing your emotions, processing them, releasing them. And then if like negative stuff keeps coming up, it's like, well, you release them and you get it off your chest. And then it's like, oh, you have peace, you have calmness. You're like, it may even helped doing processing your emotions, maybe helped come up with a solution, because I look for the solutions and things. So it's like, I guess that's why it's important for massage therapists to understand the history of the profession, but more specifically the massage modality you're doing, because if it's a specific thing to learn, like knowing that history, it's like as I talk about it, it's like a part of me still wants to learn it. I still would love to be able to go and learn the full Rosen method of body work, but I don't have the money, unlimited resources to just, here's a like $3,000 plane ticket round trip to go to California, to go to Canada, or to go to Europe to learn it, or however expensive it is. Then you have the food stipulation of, I eat plant-based foods. I'm vegan. I don't eat what everybody eats. So with the 2 intensives that I went to, I had to supplement my food because the people that was in charge of the retreat centers, they didn't have vegan options. They may have had vegetarian options, but they literally did not have vegan options for me. So I literally supplemented my food. And then they had like basically 4 meals, or like not 3 meals. They had like 3 meals, breakfast, lunch, and dinner. But I'm on a 6-hour like eating schedule. So literally that meant, okay, you choose to eat 1 meal. So it made more sense to just do lunch. So you eat the main meal with them. And then for the second meal, you you're on your own. So literally, it's like, well, you're paying for this food. You can't eat all the food. So technically, I overpaid for these intensives because I wasn't able to eat all the food because they weren't willing to accommodate my my diets. Because literally my body will reject food because people believe in eating a living being that became dead, an animal or beast. So it's like, I can't eat that stuff. My body rejects cow breast milk or goat breast milk, so I couldn't eat that. And then, my body rejects chicken eggs because it's a chicken embryo in the egg. So it's like plant-based foods only, but it's like they didn't understand that. So it's like, what are you going to do? So yes, it is important to understand the history of the every profession, but it's also important if there's specific massage modalities that you can learn or different massage techniques that you can learn, understand the history of that. So when it comes to like Swedish or who actually founded massage, I get kind of confused with the history. Because it's, again, to me, I need to know more of the details of the individual or the person and stuff like that. So let's continue on. Chapter 2 went over 30 therapeutic relationships. And so let's see what it says for the case study. Sorry, it's, I guess, hard getting to the end. Okay, case study. Chastity, a massage therapist, had a massage that was coming to an end. Not massage. Let me read this over. Chastity, a massage therapist, had a marriage that was coming to an end. She worked in a contract labor setting for another massage therapist. Jill, to minimize expenses, Chastity was looking for a cheaper apartment. Chastity had a difficult time with the separation, and the stress was evident to many of her clients. One client, Bill, had questioned her until she had finally divulged her dilemma. That night, Bill talked the problem over with his wife, Marjorie, and then offered to let Chastity stay at their camp on the river rent-free until she got back on her feet financially. Chastity was so excited to finally get a break when Jill came in to close the books for the day. Chastity was bubbling over and proceeded to tell her boss about her new living arrangements. Jill was quiet for a moment and then said, "Chastity, we need to talk." Jill's view was that accepting free rent from a client, especially one of the opposite gender, was an unethical decision. "What will you do if he just shows up and lets himself in unexpectedly?" Jill asked. "What if he asks for legitimate favors? Aren't you going to feel somewhat indebted?" Jill tried to get Chastity to understand her point of view, but Chastity just became sullen and eventually hostile. "I thought you'd be happy for me," cried Chastity, barely able to hold back the tears. Desperate the fact that Chastity had been a loyal and productive employee for several years, Jill told her that she had to make a choice, find another living arrangement or find a new job. If you were Chastity, how would you analyze the situation ethically? How would you approach Jill for further dialogue to the subject? What would your decision to be in regard to this situation? If you were Jill, what would you do yourself in Chastity's place? What, if any, compromise would you be willing to make if Chastity chooses to stay? What kind of dialogue might prevent further similar occurrences? If Chastity chooses to leave, what kind of references would you give to a prospective employer? So, basically, there are people who call themselves my parents. They said at one point, okay, you need to leave. We're kicking you out of the house. You're an adult now, even though I didn't know how to be a full productive member in society and pay all the expenses myself. I was like renting office space and like going to work when I had clients and stuff like that. Well, they like all of a sudden they're like, you need to get out of the house. We want the house to ourselves. We don't like you living with us. Get out of here. So I was in this predicament where I need new living arrangements. And so I put on Facebook, is anyone willing to allow me to rent a room? Let me come live with them and do massages for rent and barter. So, like, I felt like it was crossing lines a little bit, but some of my clients insisted on being friends on Facebook or acquaintances on Facebook. Okay. So I looked at the end of being friends on Facebook. No one's really friends on Facebook. It's really a faster way of spreading messages around of what's going in your life, But I really, for the most part, was like trying to be like, I use Facebook to post my religious viewpoints, and so I didn't like gravitate to the idea of, hey, why don't you just use Facebook as a way to try to increase business, and just talk about all the tons of massage stuff or like positive activities and stay away from religious viewpoints. So anyways, they came on and both of them, a husband and wife, ended up contacting me and were like, we're willing. I looked at another possible way of doing a living situation, but it seemed like too much work, not really doable. And then the person was like, we have other people looking into this living situation. So I respectfully declined, and these other people looked at the room, and it worked out. At the same time that the people who call themselves my parents were like, we're kicking you out of the house, I was literally in this chiropractic situation where I was bartering rent. That meant I gave massages for rent of a room for the use of a massage therapy room for clients. So I didn't have to pay out of pocket. I didn't have to pay rent anymore. And literally they're like, it's too much work to have you here. Like, I feel like I'm supporting everyone. I have to take care of my mom financially. I feel like I have to take care of you financially. You need to get out. So you have people who are calling themselves your real parents, like, I don't love you anymore. Get out of the house. That's what it came across to me. And then you have like your office space at the same time was like, okay, you need to get out. Okay? Like, go find your own spot to rent. Okay. Now, I didn't think about it before, but I was in this office space previous where there was this one massage therapist, and she's like, pay rent, and then, for a room, and it's like you all share the room, and it's like first come, first serve for the massage therapy rooms, okay? Well, there were other rooms not occupied in those office spaces. If I thought about it before, I probably would have contacted that owner and been like, hey, do you have any other rooms available to rent? Because I'm leasing from this individual. The rent keeps going up. I can't afford it. And then I would have just got a room all by myself. And then I would have just been like, this is my room. Okay. Then I would have been longer in that one place. Okay. So, yes, I took up the offer of doing massages for rent. Initially, they wanted me to pay about they wanted me to do way too many massages. I narrowed it down where they both got 2 90-minute massages. Or it was was it 1 massage per month? Yeah, I think they wanted 2 90-minute massages, and I narrowed it down where they each got 1 90-minute massage per month. And that was the full rent or something like that. Or did I give them 2? I forget. Anyways, it was something like that. But I literally was basically bartering for rent. And then that meant, they also were very good, where literally I just had to put my dishes away. I didn't really have to clean anything. So it was literally all I had to do was do the massages, and I didn't have to clean anything really but my own dishes, which helped me out. So I had way more free time. And then they had cable TV, so I was able to watch cable TV and a bunch of different TV shows. But it seemed like when I got cable, it was still there was a lot of commercials and stuff like that. So, but again, in massage therapy school, they had this thing called, you should let business be business, or your clients be clients, and your friends be friends. And it could be really hard for family or friends to take you seriously or something. So you might need to do this thing called, if you had previous friends, you're like, when we're friends, I'm a friend. When I'm a massage therapist, I'm a massage therapist. So I'm still going to act professional and give you a professional massage and stuff like that. So overall, in the end, I really felt like it was a decent living situation. But sometimes they would complain that I was cooking weird smelling food because I tried to cook beans myself, and they're like, the beans smell awful, but they cooked a dead living being, and that smelled really awful, so I was just like, I don't know why you're saying my stuff smells awful, yours smells worse. So, but I didn't complain when their stuff smelled bad, but they complained when my stuff smelled bad. So it was well, when I ended up putting spices in it, it seemed okay with it more. But it's in the end, I had to give up trying to make beans, because the reason why I was trying to make beans was because of COVID-19, things were getting more expensive, food. So I was like, if I cook my own beans from scratch, it will bring down the prices of some of my grocery bills. And it's well, nope, can't do that because they complained about the food smelling weird. Okay, how does an ethic code differ from a set of standards for practice? I don't know. What is an ethical code? I don't know. Let's see. Where is the ethical code? They're not. I don't know. It doesn't go over ethical code in here. So legitimately, I don't think this chapter should be allowed to ask that question. So let's move on to chapter 3. Tools of the trade. Let's see. Case study. Okay. Lost possessions. Tiffany owns and operates a massage therapy business, Southern Comfort, in her hometown. She has 2 associate therapists, Junanita and Suzanne, who work with her. One of the salon's most frequent clients, Rebecca, the wife of the town's mayor, scheduled a massage with Junanita at 10 a.m. Rebecca was feeling happy, sad, and tired. For the last few months, she had been planning her only daughter's wedding. The wedding was this past weekend, and Rebecca was ready to unwind. That afternoon, Rebecca telephoned to report that she left her wedding ring in the massage room. She described the ring to Tiffany as a very expensive platinum and diamond solitaire that was given to her by her husband on their 10-year wedding anniversary. After a brief conversation, a highly emotional Rebecca claimed that she does not remember putting it on her finger after the massage. Tiffany searched the massage room and was unable to locate the ring. Rebecca came by and searched the massage room as well. She even emptied her purse onto the massage table. Both Rebecca and Tiffany looked at the ring. Tiffany looked at the appointment book and noticed that both therapists used the massage room after Rebecca's massage. Tiffany told Rebecca that she would ask both Suzanne and Anita if a ring was found in the massage room, and that she would call Rebecca if it were found. If you were Tiffany, how would you approach Suzanne and Junita about the missing ring? If Rebecca sounded accusatory, how should Tiffany deal with the situation professionally? If you're Rebecca, how would you react to Tiffany's current plan of action? Okay, so with this case study, this would have been helpful to have been taught in massage therapy school. For no one went over how someone could accidentally leave something in the room, so I was unprepared for the situation. For when it came to this book, my Swedish massage therapist teacher, which she called this Swedish massage instead of massage therapy class, which goes over all of the overview of the basics of massage. She didn't go over all these case studies. It didn't register in my brain. So when I started doing Groupon, sure enough, one of the beginning clients, they accidentally left ear jewelry in the room. Not for both ears, but one of the ears for some reason. It's like, or something. And I did eventually find it, but I didn't know what to do with it because I was leasing. I was like, I thought there was like this, place where it's like, oh, okay, if anyone loses jewelry, okay, we put it in this place or whatever. And then it's like, and then you grab it. So I didn't really think of it, but then someone else that looked completely different, they're like, oh yeah, my friend came here and they left their ear jewelry here, and like they called about it, and then you didn't know anything about it, probably because I didn't know to look behind a stand where it's like there was a, what's it called? Okay, what is it? A book stand, or here's a stand by the bed, or a small table or something, and then you have a certain place to put your jewelry there, whatever. They didn't. Like they didn't describe on the phone, like when they were a client. They didn't say their name. I was confused. I needed the details. They didn't provide all the details. It didn't register, so I was like, what are you talking about? You left your earring or earrings in the massage therapy room. Because it's like, okay, they were so tired that they forgot their earrings, even though there were clothes on the chair right by the stand. Like, so I was like confused because I didn't know how to like handle the situation. But then someone came back and it's like, I'm sorry, I'll deal with the individual face to face in person or on the phone or whatever. And then I tried to be like, okay, I found your earrings. I put them somewhere else. I'm willing to replace the pair. Because it seemed like they did at that point want to come back as a client and they never showed up. So it was like I even tried to make amends and like pay, and they like just blew me off. And it was like when I tried to call them and leave a voice message for them, it's like they never returned my calls or whatever. And it was like, okay, so maybe they didn't understand what they were saying. I don't know. So it's like, but then like when I was an employer, it was like that was that one time that happened. Everyone else, for the most part, they didn't leave jewelry behind. However, there were a few clients that did accidentally leave something. I texted them or whatever, and like they came back and got their item, and then it was like fine because you caught it soon enough. So after that, I was like very diligent. Did the client make sure they remembered everything? Now, when I worked for a spa setting, there was one client. They were on their way of canceling their membership to this spa, and they said they left their ring in the room. And we looked for it, couldn't find it. It was nowhere. I have no idea what happened to their ring. Uh, uh, like, she, it's like, I don't know. Like, I didn't see it. Like, so I have no idea what happened. The person really seemed very bummed about it, but it's like, she also explained she might have not put it all the way here, that it might have been partially here, and then that would be easy to have the ring come off your finger because it only really stays if it's like before the knuckle. So I don't really understand what happened with that one. So it does happen. So clients, you may have massage fog or be like super relaxed, but relaxed to the point where you may not be with it entirely when it comes to putting your clothes back on or your jewelry back on. However, every time I went to a massage, unless I was super tired before I got the massage and fell asleep in the massage, I was with it and I remembered to put on my jewelry. So yes, we can do our best to try to help you remember, be like, okay, this is yours. But like one time it was like I was literally trading with another massage therapist and they saw my earrings or something. And what they were saying, like, it seemed like I was really tired during that massage. I have that routine of like after the massage putting back on my jewelry. And they're like, those were cute, really. I saw your earrings and they were really cute. And if you hadn't like put them back on, I was going to steal them from you. And so I thought that was unprofessional for a licensed massage therapist to joke to another licensed massage therapist that I'm going to steal your jewelry. And it kind of ticked me off. So, or like made me irritated and mad because it's like, why aren't you treating me like a real client? You know, why would you say that? You know, here I am getting massage and here you're joking about like, I'm going to steal your earrings from you if you ever leave them in the room behind. I'm going to just steal them from you, you know? So it's like, well, I'm sorry. I believe that if you're a massage therapist and you trade with another massage therapist, that you're still supposed to act like and behave and speak like a professional licensed massage therapist. So I was like not happy about that. So again, there is this thing of sometimes, you know, clients and even other massage therapists, they act all friendly and sweet and they want to know about you. They want to know what's going on in your life. But at the end of the day, they really didn't care. And really, everyone should just be okay with getting a massage with silence only. Because unless you're going to really genuinely care about other people, don't ask them how they're doing, because it's not polite. It gives people false hope if they really need someone to love them and care about them. So stop giving this information to any individual that you actually love them and care about them when you really don't. So, and that's the thing. Everyone is superficial in the society that I live. So it's like you try to make it right. They blame you for losing an earring that they can't find. Then they're like, I'm never going to come to you and you're never going to be my massage therapist again because I lost an earring in your office. Okay. It didn't even look like it was real gold to me. It looked like cheap jewelry, and they were complaining. Like, oh my gosh. But hey, if people want to be that superficial and annoying, I guess that's why I didn't ever pick up enough clients to pay all the expenses of life, because people want to blame everyone else and not take responsibility for their own actions, words, and behavior. And I really did my best to be a sweet, loving, kind individual. And what did I get back in return was a bunch of people who don't care about me at all. So, yeah, be careful, licensed massage therapist. Make sure you act like a parent that is also their licensed massage therapist, and you treat them like a kid. Now, did you remember to put back on your jewelry? Did you remember to put back on your watch? Did you remember to grab your scarf? Treat them like a kid, because they don't want to speak like adults, behave like adults, and act like adults. Why is the atmosphere of the massage studio so important to an effective practice? Are a massage therapist's skill and appearance enough? No. I thought for the most part my appearance was fine. I dressed more casual dress. So that was fine. For the longest time, I didn't wear any nail polish. I tried to do this thing of designate 2 days off in a row and then wear nail polish on those days, but it was really hard because, what's it called? Nail polishes chips easy, and then it I did make a mistake with a few clients one time when I was like, I'm gonna just keep it on, and some of my nail polish chipped while massaging a client, and I was like, nah, yeah, I shouldn't wear it, and so I stopped wearing it. So lesson learned, and never got in trouble for it. So it's like you really need some kind of waterproof nail polish to exist in order to be able to massage with someone else with nail polish, because you're washing your hands a lot. So as far as the environment is concerned, well, people in society kept asking the question, how are you? So they seemed sincere about it. And I'm the type of person that I was an open book. If you say you want to know how I'm doing, I'm going to tell you. So that could be like, how am I doing religiously or spiritually? How am I doing financially? How am I doing emotionally? Or like, what do I like doing in my life right now? What's going on bad? That's what, to me, the question means. How are you? That you want all of that answered. So no one was ever specific in the question and be like, hey, how are you doing in your life? What's going on that's good in your life? That's all I want to hear about. then I would have just like tried to be super positive and just tell them the good things. I needed that kind of specific questioning. No one ever did that. And no one ever took the time to be like, hey, when someone asks, how are you? They just want to know about the good stuff in your life only. Well, I mean, if you're Republican or Democrat and you're super excited about a certain politician or whatever because you believe in what they believe for their political views for some reason, you might be excited and share that information with a client. It could cause negativity for somebody else, apparently. And like in massage therapy school, they're like, don't talk about religion, don't talk about politics, talk about the weather. Okay. Like the weather, really, you can only talk about for one sentence. So it seemed like everyone did want some kind of small talk, but I did not learn small talk in elementary school. I did not learn small talk in high school, and I did not learn small talk in college. And they didn't really teach you how to do small talk properly in high school. And if you grew up super religious, then and everyone was talking about religion all the time, if that's your norm. So literally my way around that was like, okay, if there's something uncomfortable you don't want to talk about, just let me know and I'll stop talking about it. And so I expected the adults to be adults, be able to assess how they really felt, what emotions were really going on, and be able to truly tell me, I'm not comfortable about you talking about these different situations because I live in a negative environment and there's negativity going all around. I think it's okay to talk about negative things and positive things and try to be mostly positively like, okay, this is the negativity that's going on. Okay, da 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 da, and then get it off my chest. And I expect other people to be okay with that and do that back too. But literally, society as a whole, it's like they don't believe in emotions, they don't believe in feelings, they believe in hiding it. And so you really have a superficial society. So I really needed a book that was like, this is what you need to say when someone asks how you're doing. And I needed that superficial society book that's like, okay, never tell them how you truly feel. Never tell them any negative emotions. Be superficial, vague, and broad, because that's what they really want. However, it seemed like when I was superficial and vague and broad, then people came in and they tried to get more information out of me. So it's like, okay, then you had people who were like, no, I want you to only tell me positive things. Then you had some people who are like, no, I want to have a real genuine conversation with you. And you could never please everyone. And then it seemed like some people were like, well, unless I know the client and the client is going to like be more friendly and do the small talk thing, I don't want to continue to see them as a client. Well, if everyone were like that, I'd be happy to talk to everyone. But there were so many people that like, oh, you're a good massage therapist, but you talk too much. But you didn't communicate with me when to shut up or be quiet so that I could give you the rest of the massage in silence. Because there were clients that I'm fine just receiving this massage in silence. And when that's what they wanted to get out of the massage, I was happy to comply. And so I just thought about things in my head. And the massages were good and people still came back eventually. So, yes, you do need this positive atmosphere fear environment, but your clients and the licensed massage therapist have to be on the same standard, where if people are claiming to be adults, they need to own up to their responsibility and be like, you know what? I'm not okay talking about emotions or feelings. So we can talk about the weather. We can talk about history. We can talk about information only. But religion, emotions, that should be off the table. So really, you need this thing called, what are the topics that you're okay talking about if you want to talk during massage? That should be on the intake form for clients coming in to see licensed massage therapists. But, spas don't put that on their intake forms. And that wasn't something they taught in school. And I didn't think about it until after, even though I currently have my licensed massage therapy license, I'm not actively practicing anymore and seeing clients because clients didn't want to communicate with me and tell me exactly what they wanted out of their massage so I could give them the true massage that they wanted. You can't tell somebody, I'm fine talking during the massage, and then in the massage, change your mind and not tell the licensed massage therapist verbally that you changed your mind. Because the massage therapist isn't going to know that you changed your mind and decided, I want a nice, quiet massage now. So that is part of the problem of clients that I ran into, with society as a whole that I ran into. People don't mean what they say, and they truly want you to read their mind, even though you do not have that ability at all. So, moving on to chapter 4, self-care, health, wellness, nutrition, and stress reduction. So as you can see, grains make half your grains whole. Vegetables vary your veggies. Fruits, focus your fruits. Oils, know your fats. Milk, get your calcium-rich foods. Meats and beans, go lean in on protein. Now again, they're not showing that the majority of people believe in the milk that gives you nutrition is breast milk from some kind of animal or beast. And they're not telling you that they really believe in eating for meats, not plant-based meats, but a living being that became dead. And literally they eat the muscles, they don't eat the skin. So it's like gross. And then the other thing is I told them, people should they would become more healthy if they went vegan or ate plant-based foods only. And people are like, no, I'm going to eat whatever I want. And it's like, okay. So it's like, as a massage therapist, I did my best to be healthy. And they literally did not believe me when I gave health advice. So it was like, at the end of the day, people are going to believe what they want to believe. And they may not believe anything you say at all. So, and if you try to tell them this is the proper definition of a word, they're like, no, I'm gonna have, this word mean what I want it to mean. So again, another case study. Okay. Margaret was a recent graduate from the Gulf Coast School of Massage. She acquired her state license and began her practice at well-established chiropractic clinic. Margaret massaged the physician's patients before their spinal adjustments. The patients loved the massage, and the physicians loved that the patients reported improving more quickly with the addition of massage before the spinal adjustments. Mark was Margaret's next client. It was Mark's first massage at the clinic. He was a car sales associate uptown and recently involved in a minor car accident. Mark's chiropractor gave clearance for him to begin receiving massages because Margaret was asked to address his back, neck, and shoulders only. Mark left on his trousers. When Margaret re-entered the massage room, Mark was lying prone with the sheet draped across his back and legs. Margaret lowered the sheet and observed a large portion of his back covered with red circles. The edges of the circles were slightly elevated, and she noticed a slight odor to his skin. Should Margaret continue with the massage? Should Margaret ask the client or the physician about the circles? When should she make the inquiry? Should she consult the physician before or after or during the massage? Well, if she's in the chiropractic office and she's not sure what those circles are, yes, definitely grab your chiropractor and be like, I just have to ask the chiropractor what's going on, because, if, with chiropractic care, you receive chiropractic care with your clothes on only. So with massages, you can receive, if it's a quick massage, they could do chair massages or be on the table fully clothed, getting some kind of massage through the clothes. So if there was some kind of circular mark and he left his shirt on, she wouldn't have caught it, and she would have just massaged through the clothes. However, now that there's these red marks that are appearing, you really, to be able to ask this question, you need a photo to understand exactly what are the red marks are. So because if you study pathology, there are certain marks for a certain reason, and it means a certain disease. However, there have been times where I've used this device called Thumper Mini Pro, and or it's rapid tension relieving device, where it like vibrates the muscles, and there were times where I used that on the person before massaging them, and then it brought circulation to that area, and you saw red marks. Also, the circles could be cupping, right? Where someone received cupping to help bring blood flow and circulation to the area. So the chiropractor could have used cupping on that. So then it's like, well, then the chiropractor should have mentioned that to the licensed massage therapist and be like, by the way, just to let you know, I cupped this person to help alleviate some of the muscle tension because it was not adjusting properly for me, and then cupping helped relax it a little bit, and so then I was able to adjust them. So when they get their massage from you, you could see red marks or whatever. So that's probably what was going on, or it could be a rash. So it's like, again, this picture isn't really, there is no picture here, so it's not telling you what are the red circles. So that's what is coming to mind as like I was brainstorming and trying to figure out what was going on. What is meant by the proverb, physician heal thyself, and how can massage therapists apply this principle to their practice? Physician heal thyself. Okay. Well, I didn't know it necessarily when I went into massage therapy, but initially, when I was in massage school, it seemed like because you were receiving safe, loving touch in a professional way from boys and girls, that it was healing me. I felt so loved. In the student teaching atmosphere, it was like the best part of massage, where it's like you're loving the ones that are around you, and they're loving you too. It was like a better massage environment. And I deeply miss it because the students seem all interested in really learning and growing, and the teachers really did seem like they really wanted to teach us how to do the best we could. That's what came across. However, it's like it was so fast paced that it's like, well, now I'm second guessing. Well, it's like, is massage therapy really supposed to be a career? Or is it supposed to be done in a different way where you start off with teaching people how to do a clothed table massage, or it's clothed table massage and chair massage, and you learn that certification and you get certification for that modality only. And then if you want to learn more modalities, then you get more and more certifications. And then you're licensed to be a bodywork professional or massage therapist. It's based on, did you get this certification? And you may need a certain many hours with that certification process to be able to work on individuals or whatever. So that would have been a better system of how to do things, but that's not what they did. It seemed all scattered all over the place, and so it's like I did my best in this situation that I was in, but it's like if you reorganize massage and there's different massage modalities, that's how I'd want to do the licensure, right? Like you have a license, and when you get a certification, you contact the government. You're like, I got this certification. This is how many hours. Okay. And that goes under your license. And that makes it easier to be like, oh, I want this type of massage therapist. I want this type of massage therapist. Or you may not want to be able to do all the different types of massage modalities, right? So then it's like, okay, here's different massage modalities, and they have a close on. That would be pick one and find your massage path of what you want to offer in your specific massage therapy practice, right? So again, it seemed like there was no communication between the chiropractor and the massage therapist before this individual actually had their massage, and that could be part of the confusion of what is going on. The massage therapist may not have any experience with cupping, because cupping can lead those red circles, especially if you leave it on for 10 minutes. So, but I found that it worked better to leave cups on, silicone cups on for 10 minutes in a static place, because it actually did alleviate a little bit of the muscle tension, but it was more hitting the superficial muscles only. Okay, yeah, so physician, heal yourself. Sorry, back to that. Okay, well, I went into massage therapy. My intention was just to do it to help other people. But in massage school, because I was receiving that safe, loving touch, I was like, maybe I did this for me too, because this is really nice, being physically loved in a safe, loving way. And it seemed like it was healing me emotionally. And so I was thriving more. Same with the Rosen method of bodywork. It was safe, loving touch, and it added the emotional component where it's like it's okay to express your emotions. So that's really what the type of massage I was gonna go towards, where it was like I wanted to switch over to provide that safe, loving place for the client to express their emotions and learn how to do that and provide that for every client. And then maybe I could have added that component of, we're going to do Rosen a little bit and do the in like, I don't know, like I really wanted certain massage modalities to be like, if you want this, this is what you get. If you want this, this is what you get. If you want this, this is what you get. If you want this, this is what you get. Or it could have been that thing of, here is how much time you need for a Rosen session. Do you want a combo like massage bodywork modality or bodywork modality? Because you can do 50 minutes for a Rosen session, or maybe even 40 minutes for a Rosen session. And it's like, you may find that you may need to combine different techniques. Like, okay, why are your muscles stuck all the time in a tight position? Maybe you need to release some emotions. So, I found like being in this profession, it allowed me to have more avenues to actually heal myself because you're studying it more, right? Because you're reading it and stuff like that. So it was very helpful with like physician heal yourself, massage therapist heal yourself. However, I realized there's something wrong with the whole entire environment that I'm in, because people said this will work and it will heal you. This will work and it will heal you. Be vegan, it will heal you. Express your emotions, it will heal you. Like, I really thought those were the type of clients I would attract to me, where it's like, oh yeah, these clients want to express their emotions too. These people want to express their emotions too. These people are into healing. They want to be healed too. Well, people just talked the talk and it was like nothing was working. So it's like, it seems like in the ends, like, I feel like I'm the only one that truly wants to heal. No one else truly wants to heal. No one else truly wants that positive environment. I truly want to get rid of the negative environment. I want to go to a more positive environment, but I don't know how, because people don't say what they mean and they don't mean what they say. So it's like, well, to heal myself, I guess I have to be by myself. That's what I came to the conclusion. So last chapter, research literacy. Case study. Sally is a massage therapist. Harold is an acupuncturist. Teresa is a medical doctor who recently decided to learn more about how to integrate less invasive, no pharmaceutical treatments for her patients with chronic pain. Each made a good case for their approach, but Teresa asked Sally and Harold if they would be willing to give her one research study explaining the benefit of their clinical method on the lower back pain. Sally submitted a peer-reviewed study titled Reduction of the Anterior Pelvic Tilt Using Massage Therapy Reduces Low Back Pain. The study included 5 subjects presenting with the lower back and no history of disc pathology, nerve pathology, broken bones, or systemic pathology, how to contribute to chronic pain. Each of the subjects presented with hyperdosis, noted specifically by an increased anterior pelvic tilt of 5 to 10 degrees. Each subject was treated by the same massage therapist using the same sequence of strokes. Subjects were instructed to refrain from using pharmaceuticals within 4 hours of each treatment and to note each use of pharmaceuticals during the duration of the study. They were also instructed not to receive any or other treatment for the condition. Each subject received 5 40-minute treatments over the course of 1 month. 4 out of 5 of the subjects had significant relief of symptoms. 1 subject had moderate relief following the first 2 treatments, but no significant improvements subsequently. The study concluded that massage therapy reduces lower back pain resulting from an anterior pelvic tilt. It was funded by Healing Hands Incorporation, a privately owned chain of clinical massage therapy clinics, and conducted on site at one of their facilities. Harold submitted a peer-reviewed study titled Acupuncture Significantly Reduces Lower Back Pain. The study was conducted over 24 months and included 121 subjects. 19 of the original subjects dropped because of their healthcare provider disapproved. Subjects selected were evaluated for potential causes of lower back pain and were accepted if cause of pain fell into one of the three categories: herniated disc, lumbar ligament sprain, or strength imbalance between the hip flexors and lumbar extensors. Acupuncture treatment protocols differed depending on the cause of pain and followed the traditional model of Chinese medicine used for each condition. Each subject was consistently treated by one of 10 acupuncturists who received from different institutions. 60% of subjects reported complete relief of symptoms, 20% reported moderate relief of symptoms, 10 reported moderate relief of back pain but experienced new pain in other areas of the body. 10% had no significant change in symptoms. The study was conducted at a respectful university and funded by the National Institutes of Health. What are the pros and cons of each design? Are there elements in either design that may affect the reliability of outcomes? Are the study designs too narrow, too broad? Explain. Describe how you would improve each of the studies. If you were to submit either of these studies for your client's consideration, would you explain the shortcomings even if you believe the outcome is reliable? Okay, what I saw for pictures when it came to acupuncturists, they used needles to put into the skin. I never got it done. They said it alleviates pain in the body. I have never experienced it, so I don't know if it works or not. However, there is pressure points where you could put your thumb or your finger on certain pressure points on individuals, and that could help alleviate muscle tension and different things, or maybe pain in the body. I don't know. So these studies that are given, it's done in a super broad and vague way where it doesn't actually show you the details of what they're doing on the clients to understand if it's really going to alleviate the pain or not. So it's too broad and vague for me to be like, yes, no. But if you switch out, the pelvic, whatever it said, the lower back pain and basically the hips out of alignment, I would say you need to probably see a chiropractor too, because you need that chiropractor to put your hip back in alignment somehow, because there could be muscles pulling it out of place. So if you did chiropractic care, get a massage, and if you did the acupuncturist stuff in the hip area, would that actually help relieve all the pain? I do not know, but it's something you could try. Again, what I have found in the super negative environment that I am in is literally people are not giving the true solutions to your health problems if you have real health problems. So you need the real solutions for it to be able to work 100% to actually help alleviate pain and stuff. Otherwise, it's not going to be effective, and some of it may work a little bit or it may not work at all. So that is my perspective as a licensed massage therapist who has tried a bunch of different health things, from medical doctors, from nutritionists, from massage therapists, and it seems like no one fully knows what they're talking about and what actually works effectively 100%. So, if massage is beneficial for helping injuries to heal, why is massage contraindicating during the first few days after an injury? Okay. So, there could be swelling or inflammation in the body, and you wouldn't want to do a massage. However, if you're okay with a massage therapist doing a hot and cold treatment on you and not massaging you at all, then what you could do is, for that injury, as long as you do not have a fever, what could happen is you like nutritionists or naturopathic doctors, they said a home remedy that you can do on yourself is hydrotherapy, or a hot and cold treatment, where you have hot water, as hot as someone can comfortably stand, and you alternate towels, but you literally put hot water on the person, and you do hot with water, and then you use some kind of cold or super cold water with like a washcloth, and then you put cold on that person, and then you do the hot for 3 to 5 minutes, and then you do the cold for 30 seconds to a minute, and then you alternate at least 3 times in that area, and then it helps bring down the inflammation. So you could do hydrotherapy treatment on somebody, and in that area that's injured, they can't receive a massage. But some people, they were like, this area's injured, so they're just like, don't massage that area. Okay, and then you massage the rest of the body. However, to do a true proper, so if you do like 5, 10, 15, 16, 17, 18, you literally need about 18 to 20 minutes to do just one side of an area for like hydrotherapy treatments. So say it's like you really should do both sides of the ankle, right? So then you would need like 40 minutes designated just for hydrotherapy, for it to be way more effective. And I did have a client at one point. He complained of rheumatoid arthritis in his hands, and I did the hydrotherapy on him twice, just his hands, and he said it took away the pain in his hands for 2 hours. So I don't know if it was just 2 hours. It could have lasted longer. I don't know. Again, it depends on each individual and what is true health. That is the question. What are the true solutions to true diseases? Because that's what we all truly need in order to heal. So those are the case studies. I have been forgetting to do them at the end of the chapter. I thought they were important, and as I'm trying to remember what my main massage teacher said in massage school, she might have verbally mentioned, hey, do these case studies, in this book, and she mentioned it one time. Well, that didn't get the message in my brain, because they were mentioning so much stuff. So sometimes you need people to mention things over and over again within reason. So I hope you found this video informative. Again, this was chapters 1 through 5. Do you want there to be the right definitions for diseases and the right solutions for healing those diseases? Do you want those? Because that's how you create a positive society, or a more positive society. You have to get to this place where you change the whole medical system, instead of being like, okay, I want this disease to go with this solution, or this name of this disease to go with a completely different definition. You need the proper name of the disease, the proper definition. You need the proper diagnosis. You need the proper solution of how to heal that disease. Otherwise, no one's ever going to get healed, and they're going to stay sick. Because you can't just make up solutions and expect them to work. They actually have to work. It has to be scientifically proven. And so it just seems like we're in a society where people are making a whole bunch of stuff up. Religion, health, government, maybe even the family dynamics of how things are supposed to work in a family. Because we have a superficial society where nothing really works. For me, that's not okay. That's causing a super negative environment. So I would like to get out of here and go to this super positive environment where it's like, here's true health, here's true religion, here's truth, what a true family looks like. This is how you treat each other with decency and respect. This is how true friends work. This is how you treat each other with decency and respect. This is how two healthy people have a two-sided relationship with each other, where you do your part to have a relationship with them, and they do their part to have a relationship with you. This is how you keep professions professional, where if you do have closer relationships with friends and family, when you do your work, this is how you stay work focused and be like, okay, do you want to talk? Do you not want to talk? Okay, just if you change your mind during this professional service that I'm going to do for you, please let me know and change your mind. Because right now, like when it comes to tasks, I do better if I'm focused on that one task. It's not easy for me to multitask, okay? Even with cooking, I'm like, okay, you need this ingredient, you need this ingredient, okay, put them all together, okay, mix, okay, you forgot to turn on the oven, turn on the oven, okay, you put it in, set the timer, okay. So today I literally was doing something with the oven, had the timer on for the first two things in the oven, was doing dishes, forgot to reset the timer. So I was like, well, for the last batch of stuff that I was baking in the oven, I was like, I don't know how many minutes it baked for. Oh well, didn't overcook them, it's okay, whatever, you know. And then I'm finding when it comes to certain recipes, in the temperature of the oven, the time and the temperature are not accurate for baking everything. So even like electrical devices and ovens and stoves, it doesn't work properly and the same all the time. So that creates a negative environment. So to create a better positive environment, even with your stuff, you need the scientific stuff down pat, where it's like, you need this temperature in this many minutes. You need these ingredients. Put them all together. Mix it. Put it into your different shapes. Put it in the oven to bake. Voila. So I was basically trying to make crackers, okay? But you know, you could have cookie dough, right? Or cracker dough. So I was having cracker dough, and I was like, I don't know, did it turn out right? We'll see. I haven't had it yet because I got full. Anyways, but you need stuff to work. You need the proper recipes. You need the proper patterns. You need the proper solutions. That's only how things are going to get positive and improve, is if you have the proper alphabet, the proper distinct sounds, the proper words, the proper definitions, the proper meanings of words. And then if there are problems, then it's like, overall, these are the solutions. If you follow these solutions, they will work, right? So, but it is talking properly. It's having true health, true religion, true family, true friends. And when you have any type of relationship with anyone, whether it's your parents or your siblings or your friends, it's not just one person's responsibility to do everything for that other individual. To have a relationship with someone, you both need to talk to each other. You both need to value each other's time and love and what you do for each other. And it's not just one person doing everything for everyone else around them. And so that's why I feel like I'm in this super negative environment where it's like, literally, I have tried to do everything right and all I do is fail. So is it because people don't mean what they truly say or say what they truly mean? This is creating a negative environment. So we need a society to speak what they really mean and say what they really mean. So I don't know if society's ever going to change to that, but I know I look forward to the day when I can get in that more and more positive environment and learn how to talk properly and speak properly and have the proper recipes, even have like robots massage me and do a thorough, wonderful job, and have that food work properly, where it's like, okay, why can I not heal? Do I need to speak a blessing, a very specific blessing with my food for my body to heal? Then I look forward to receiving books in the future with those specific details of like, say this blessing. You have to speak it, every letter properly and every word properly for the blessing to actually work. That's probably why my blessings aren't really effective, because I must not speak the written language that I have correctly for some reason. So I'm looking forward in the future to be re-educated and have proper educational materials. So if you think there's super negativity going on in your environment or in your life, what are the solutions that you want implemented in your life so you can have that positive environment? Feel free to comment in the comment section below what strategies you actually effectively use or have been effectively helpful to help you get into a positive environment. And I mean a real positive environment, not just pretending that you have a positive environment, a real positive environment. So again, on this channel, Different Careers with Kate Nudd, I allow positivity and negativity to be here, because they're both allowed. Because if you're in a negative environment, you do need to express it in a healthy, safe, loving way that doesn't bring any physical harm to anyone else. So if you can't handle someone talking about negative stuff, and if you're going to claim that by hearing someone else speak about their negative experience, that it's going to traumatize you, then you should stay away from all of my channels. So, different careers with Kate Nudd is one of them. And then I have a bunch of channels, like 3 under the name Truly Writer or Truly Jacob or Writer. So, just throwing that out there. And again, is this my real name, Kate Nudd? Or is this just the name someone decided to give me? I don't know. But we'll see what the truth is in the future. Until next time.